Ever wondered what separates a virus from an infection in children? It's a question that has puzzled many, and today we're going to dive into the topic head first. You see, the world of microbes is vast and varied, and to the untrained eye, it can seem overwhelmingly complex. But fear not, we're here to demystify it. Let's start with the basics. Viruses and infections are not the same thing, though they are often used interchangeably in everyday language. A virus is a tiny infectious agent that can only replicate inside the living cells of an organism. On the other hand, an infection is a process where an organism, which can be a virus, bacteria, fungus, or parasite, invades the body, causing a disease. Common misconceptions often arise from the overlap in symptoms, leading many to believe they're one and the same, but they're not. By the end of this video, you'll have a clearer understanding of these two medical terms and how they affect children. First off, let's tackle viruses. Viruses are microscopic invaders that seize control of our cells, using them as factories to replicate themselves. They can't survive or reproduce without a host. That's us, or our little ones. When a child catches a virus, it might manifest in different ways, depending on the type of virus and the child's overall health. Common symptoms may include a runny nose, cough, sore throat, mild headache, or fever. Now, you might be wondering, how is this different from an infection? Well, an infection is a broader term. It occurs when any foreign organism, not just viruses but also bacteria, fungi, or parasites, invades the body and causes disease. So all viruses can cause infections, but not all infections are caused by viruses. In short, a virus is a microscopic parasite that needs a host cell to reproduce, often causing illness in the process. Now, on to infections. Infections occur when harmful microorganisms, such as bacteria, fungi, or viruses, invade our bodies. They take over our cells, using them to multiply and often causing harm in the process. It's a bit like a home invasion, but on a microscopic level. When it comes to children, infections may present through various symptoms. These can include fever, cough, fatigue, and in some cases, a rash or upset stomach. It's important to remember that these symptoms can be common to many illnesses, not just infections. So how do infections differ from viruses? Well, a virus is just one type of microorganism that can cause an infection. Other culprits might be bacteria or fungi. The key difference is that while all viruses can cause infections, not all infections are caused by viruses. So, an infection is the invasion and multiplication of microorganisms in the body, which can be caused by various agents, including a virus. Knowing what you're dealing with is half the battle. The other half is knowing how to respond. When it comes to viruses and infections in children, the treatment can vary. For many viral infections, rest and hydration are key. Over-the-counter remedies can also help manage symptoms. However, if your child's condition worsens or doesn't improve, it's time to seek medical advice. Preventing viruses and infections is just as crucial. Simple habits like proper hand washing, maintaining a balanced diet, and ensuring your child is up to date with vaccinations can go a long way. Remember, prevention is better than cure. For bacterial infections, antibiotics prescribed by a healthcare professional are often necessary. But it's important to note, antibiotics won't work for viruses, so it's crucial to understand what's causing your child's symptoms. When it comes to your child's health, it's okay to be cautious. If you're ever unsure, make that call. Remember, when in doubt, always consult a healthcare professional. To sum it all up, viruses and infections are not the same thing. Viruses are tiny microscopic entities that invade cells and use them as factories to multiply. They cause illnesses like the common cold, or more serious diseases like measles or chickenpox. On the other hand, infections occur when harmful bacteria or other microbes enter the body and start to multiply, causing problems like strep throat or ear infections. The symptoms of both can often overlap, making it difficult to distinguish between them without professional medical advice. However, knowing the general characteristics of each can help you make informed decisions about seeking medical attention. As for treatment and prevention, remember that while antibiotics can be effective against bacterial infections, they are not effective against viruses. Prevention is often the best medicine, with hygiene practices playing a crucial role. And that wraps up our discussion for today. Stay informed and keep your family healthy.